And so the next time someone asks you, do you have mental health? Please, with your full chest, say what? Yes. The reason why many of us decided to sit on the fence is because of what? The word mental. Because mental often connotes what? Kolo, Yaba left, Looney, Arrow. Thank you. We also often see mental health as a have or have not. It's also very important this morning that we understand that all of us are on that continuum. And depending on the challenges that life may throw our ways, and the resilience and the support that we have, we can wield under pressure. Today I invite us to reflect on why mental health is not just a medical issue, but a human right. And how pharmaceutical professionals like yourselves, of course the speaker is not a pharmacist, not just yet. The Marat is not a pharmacist, not just yet. What roles you can play, the pivotal roles you can play in advancing this course. The WHO says that health is not just the absence of disease or infirmity, but a complete state of physical, mental, and social well-being. I will not overflog the definition of mental health because Brigadier Mara spoke about it. Mental health, however, remains unfunded, stigmatized, and inaccessible for millions. You know, sometimes we joke about it and we say, me and my guys. So imagine that you and your guys are 4. And the WHO says that 1 in 4, at some point in their lives, will have a mental health challenge. If all of your guys are okay, what does that tell you? If it be you. Unfortunately, in spite of the large numbers of people that suffer from mental health conditions, more than 2/3 do not get access to the help that they need. It is important to reiterate that everyone has the right to live with dignity, free from discrimination, regardless of their mental health status. Over the years, and even in our cities, persons with mental illnesses are treated shabbily. They are starved, they are flogged, chained to trees, abused by their healers, even as they try to get access to care. Access to care should be equitable, affordable, and integrated into general health services. And of course, like the speaker said, our legislations and policies often lag behind other healthcare policies, particularly in a country like Nigeria. It is about time that we recognize that mental health is a basic human right, such that we start to shift the conversation from charity or optional support. We shift the conversation from ostriches like head in sand. Most times we look at mental health conversation as, it doesn't concern me. It's not in my house. So why should I care? And so we need to shift that conversation to one of support, to legal, moral, and professional obligation. Number 2, as the inner engines, we must realize as pharmacists that without mental well-being, personal growth is severely limited. Mental health is at the core of everything that we do. Our resilience, our self-confidence, learning and productivity. A child with untreated anxiety, and yes, even children have mental health conditions, may struggle academically in spite of high intelligence. An adult with depression may underperform at work or withdraw socially, affecting not just self-esteem, but income and family life. Woe betide us if he doesn't go ahead to end his own life by suicide. What then is your role as pharmacist, you may ask? You are the most accessible healthcare professionals. They come to you as a first port of call. Brigadier Mara said, many of them even walk in without prescription, being their own doctors, telling you their own symptoms and telling you this is what I want. You are accessible. And so just like they go to the imams, the churches and traditional healers, you can support adherence to psychiatric medications. You can say no when they come without a prescription. You can say no when they come with a prescription that keeps asking for the same thing over and over again. You can provide psychoeducation and identify patients who may be struggling. You can notice their patterns. This person keeps coming with cough, cold, and keeps asking for codeine. This person keeps coming with body aches and pains and keeps asking for tramadol. You can provide clarity. Do you know that if you keep using this might happen to you? You can inform their trusted loved ones. I'm concerned about your relative. Are we sure that we don't have a drug abuse problem going on? And you can point them in the direction of help. I want us to know today as pharmacists that investing in mental health unlocks human potential, which is a prerequisite for success, education, employment, and empowerment. At the level of the community, we must know that communities are not just collections of individuals, they are dynamic ecosystems. When mental health is neglected, it touches all of us. We see a ripple effect, rising rates of substance abuse, domestic violence, homelessness, and crime. Without mental health, not only the patient suffers, we all suffer. The greatest deterrent as a community to seeking help for people who struggle with mental health issues remains our perception, our attitude, our language, and our behavior. What do we say about them? Is madness has started again. It has started to go colo mental. All of this affects whether or not they seek help. Our stereotypes and the negative portrayal of mental health issues continue to fuel the discrimination. When you watch African Magic, somebody stays in a room and says that, Lagbaja has hurt me. And so he puts powder on his hand. And what does he do? And in the next scene, what do we see Lagbaja doing? Taking off his clothes. Negative portrayal. The ignorance does not help. Stigma and discrimination comes from all of us. From society, employers, the media, our friends, and our family, and even patients themselves. The indicators are poor. The numbers are not lying. My patients are increasing every day. Our patients are increasing every day. There's a decreasing number of professionals because of the what? Japa. Although people are saying now there's what? Ijapada. There's poor funding and there are poor recovery rates. As pharmacists, what is your role? Your community presence is a gateway for mental health advocacy and stigma reduction. We can work together to build resilience. And like he said in the Three Musketeers, all for one and one for all. You can normalize conversations about mental well-being and collaborate with other mental health professionals for holistic care. On socioeconomic development, which is the last pillar of your theme, let's talk about the numbers. Depression and anxiety cost the global economy over $1 trillion annually in lost productivity. That's according to the WHO in 2020. However, for every dollar that we invest to improve mental health care, there is a return of $4. Countries with better mental health services report higher labor force participation and reduced disability costs. It's not just because the speaker is here, but because I know that Lagos State continues to outrun and does the work on mental health. And so all the things that he was saying about mental health in Lagos are true. I'm hopeful that we can replicate this in other states and at community levels as well. We must identify that mental health is a pillar of sustainable economic development, not a drain on national resources. It is a long-term investment. I must acknowledge the barriers, stigma, and cultural misconceptions. Shortage of trained mental health professionals, underfunded systems and fragmented services. But we can change this trajectory. with collaboration, with commitment, and with courage. What are the opportunities for the Pharmaceutical Society of Nigeria? Please advocate for mental health training in pharmacy curriculum. We must develop community-based screening tools in pharmacies. And so when people come to us and they keep coming back over and again, have simple tools that you can use to assess whether or not this individual is in distress or this is just a routine condition. We of course have underfunded systems and fragmented services, and so we must partner with psychiatric services for integrated care models. My call to action, as I bring my conversation to a close today, is that mental health is not a footnote in public health. Mental health is a cornerstone of our human dignity, of social justice, and national prosperity. As pharmaceutical professionals, you are not just dispensers of medicine. You are the gatekeepers. You are the custodians of well-being. And I would like to add that you are the superheroes that do not wear capes. Yes, please give yourselves a round of applause. And so I say today that you have the power to combat stigma, to improve access, to promote equity, to empower healing at both the individual and systemic level. Distinguished fellows of the PSN, ladies and gentlemen, let us unite, move forward together, committed to a world where mental health is protected,